Today we are going to talk about very important topic, that is menstruation, and I want you to give all your ears and attention to this topic, which people feel it so much ashamed to talk about it, but today I'm going to air it out. As a lady and as a woman, I am so proud about menstruation and whole thing that encompasses it. Let's start with it. What is menstruation? Menstruation is like having a period, which is the monthly shedding of uterus lining in women of productive age. So this process involves bleeding and occurs as a part of menstrual cycle, typically lasting for 3 to 7 days. It's natural part of human reproductive cycle, preparing the body for potential pregnancy each month. So we are going to do some basics here, talking about preparation. Each month the uterus is lining thickens to prepare for a potential pregnancy. Then there is shedding. If pregnancy doesn't occur, the thickening lining along with some blood is shed and expelled through the vagina. Then there is cycle. This shedding is menstruation, and is part of menstrual cycle, which typically lasts around 21 to 35 days, though this can vary. Hormonal control. The menstrual cycle is regulated by hormone produced by the pituitary glands, hypothalamus, and ovaries. So let's look more about menstrual cycle. I'm going to discuss with you. So menstruation, as we've said, is monthly shedding of the lining of uterus. Menstruation is also known as terms menses, or menstruation period, or menstruation cycle, or a period, which is partly blood, is the shedding of blood, and partly tissue from the inside of the uterus, from your uterus through your cervix and out of your body through your vajayjay. Talking about vajayjay or vagina, menstruation is driven by hormones. Hormones are chemical messengers in your body. Your pituitary glands and your ovaries make and release certain hormones at certain times during your menstruation cycle. These hormones cause the lining of your uterus to thicken. This happens so that if a pregnancy will occur, an egg can implant into your uterine lining. Hormones also cause your ovaries to release an egg. The egg moves down your fallopian tubes where it awaits for a sperm. If a sperm doesn't fertilize that egg, pregnancy doesn't occur. The lining of your uterus breaks down and sheds, and this is your period. So if when you reach a month and you see that you are not actually having your menstrual cycle, and maybe you've indulged yourself into sexual activity, there is a possibility that your egg has been fertilized. What is a menstrual cycle? The menstrual cycle is a term used to describe the sequence of events that occur in your body as it prepares for possibility of pregnancy each month. Your menstrual cycle is the time from the first day of your menstrual period until the first day of your next menstrual period. Every person's cycle is slightly different, but the process is the same. So how long is a normal menstrual cycle? The average length of a menstrual cycle is 28 days. However, a cycle can range in length from 21 days to about 35 and still be normal. So how many days between period is normal? The days between period is your menstrual cycle length. The average menstrual cycle lasts 28 days. However, cycle lasts as little as 21 days, as long as 35 days can be normal. So how long does a period last? Most people have a period for between 3 and 7 days. So that's how a period lasts. So is a 3-day period normal? A period is normal if it's anywhere between 3 and 7 days. Well, on the shorter end of the range, some people have menstrual period for 3 days. This is okay. What are the 4 phases of menstrual cycle? So we are going to discuss about the phases of menstrual cycle. So you should know the phases. The rise and fall of your hormones trigger the step in your menstrual cycle. Your hormones cause the organs of your reproductive tract to respond in a certain way. The specific events that occur during your menstrual cycle we start with the menses phase. This phase begins on the first day of your period. It's when the lining of your uterus sheds through your vagina if pregnancy hasn't occurred. Most people bleed for 3 to 5 days, but a period lasts only 3 days to as many as 7 days is usually not cause of worry. Then there is a phase called follicular phase. This phase begins on the day you get your period and ends at the ovulation. It overlaps with the menses phase and ends when you ovulate. During this time, the level of hormones estrogen rises, which causes the lining of your uterus, the endometrium, to grow and thicken. In addition, another hormone, that's follicle-stimulating hormone, causes follicle in your ovaries to grow. During days 10 to 14, one of the developing follicle will form a fully mature egg. Then you have ovulation. Ovulation, this phase occurs roughly at about days 14 in a 28-day menstrual cycle. A sudden increase in another hormonal causes your ovary to release its egg, and the event is ovulation. Then we have luteal phase. The luteal phase. This phase lasts from about day 15 to day 28. Your egg leaves your ovary and begins to travel through your fallopian tube to your uterus. The level of hormone progesterone rises to help prepare your uterine lining for pregnancy. If the egg becomes fertilized by sperm and attaches itself to your uterine wall, you become pregnant. So from date 15 to 28, if you happen to have any sexual period there, the egg has already started traveling from the ovaries towards the fallopian tube. So when it meets the sperm, it will get fertilized, and that's when progesterone hormones are being released to prepare you for pregnancy. If pregnancy doesn't occur, estrogen and progesterone levels drop, and the thick lining of your uterus sheds during your period. So, at what age does menstruation typically begin? People start menstruating at the average age of 12. However, you can begin menstruating as early as 8 old or as late as 16 old. Generally, most people menstruate within a few years of growing breasts and pubic hair. People stop menstruating at menopause, which occurs at about the age of 51. At menopause, you stop producing eggs, stop ovulating, you reach menopause when you haven't gotten a period in 1 year. What are symptoms of getting your period? Some people experience symptoms of menstruation and others don't. The intensity of these symptoms can also vary. The most common symptom is cramps. The intensity, cramps. The cramping you feel in your pelvic area is your uterus contracting to release its lining. Other signs you getting your period are mood changes, trouble sleeping, headache, food cravings, bloating, breast tenderness, or acne. For me, I do experience acne most of the times and cramps. How does your period change over time? Your menstrual cycle can change from your teen years to your 40s or 50s. When you first get your period, it's normal to have longer cycle or heavier period flow. It can take up to 3 years for young people to have regular cycle after the beginning menstruation. A normal menstrual cycle is a cycle that occurs roughly every 21 to 35 days, causes bleeding for between 3 and 7 days, occurs once you reach your 20s, your cycle becomes more consistent and regular. Once your body begins transitioning to menopause, it will change again and become more irregular. It is also normal for your period to change during other life events that affects your hormones. such as after birth or when you are lactating. So what is considered as an irregular period? Irregular period or regular menstruation describes anything that is not normal menstruation period. Some example of regular periods are periods that occur less than 21 days or more than 35 days apart. Second is not having a period for 3 months or 90 days. Menstruation flow that's much heavier or lighter than usual. Periods bleeding that last longer than 7 days. Periods that are accompanied by severe pain, cramping, nausea, or vomiting. Then bleeding or spotting that happens between periods. How much will I bleed during my periods? You can expect to lose between 2 or 3 tablespoons of blood during your period. Some signs of irregular period bleeding are bleeding throughout a tampon or a pad every 1 to 2 hours, passing blood clot larger than a quarter, bleeding longer than 7 days each time you have your period. It's normal to experience some variation in amount of bleeding each cycle. It's also important to remember your normal may be different than someone else. Try not to compare. Talk to a healthcare provider if you are concerned about irregular or severe bleeding during your periods. How do I track my periods? It's good to be aware of your menstrual period. Not getting a period may not seem like a big deal, but an irregular period can be a sign of a problem. Your healthcare provider will also ask you about your most recent period and menstrual cycles. Knowing what's normal for you can be very helpful for your provider. Tracking your period can also be helpful in knowing when you ovulate, which is when you are most likely to get pregnant. It can also help you plan ahead or prepare for period bleeding during a special event or vacation. To track your period, mark the first day of your period on a calendar with an X. This is day 1. Continue to mark each day you are bleeding with an X. Stop marking when your bleeding stops. When bleeding starts again, mark it with an X. This is day 1 again. You can then count the number of days between each first X to get to the length of your cycle. Count the number of X's to see how many days bleeding lasts. Okay? When should I worry about my period? Contact your healthcare provider if you haven't had a period by the age of 16, you don't get your period for 3 months or longer, you are suddenly bleeding for more days than usual, you are bleeding much lighter or much heavier than usual, you have severe pain during your period, you have bleeding between periods, you feel sick after using tampons, you think you might be pregnant. For example, you've had sex and your period is at least 5 days later. Then your period hasn't come within 3 months of stopping birth control pills and you know you are not pregnant. You have any questions or concern about your pregnancy, your period, or possibly pregnancy? So, I hope you've gotten a clue of what menstrual cycle is, how to know how many days you should be waiting for your menstruation, or how many days you're supposed to do the bleeding. So, to add on that, I like to explain a few things which I have here. Just give me a second. I want us to discuss the phases again. There's this phase called luteal phase. The luteal phase begins after ovulation. It lasts about 14 days and ends just before a menstruation period. In this phase, the ruptured follicle closes after releasing the egg and forms a structure called a corpus luteum, which produces increasing quantities of progesterone. The progesterone produced by the corpus luteum does the following: prepares the uterus in case of an embryo is implanted, causes the endometrium to thicken, filling with fluids and nutrients to nourish a potential embryo, causes the mucus in the cervix to thicken so that sperm or bacteria are less likely to enter the uterus, causes basal body temperature to increase slightly during the luteal phase and remains elevated until a menstrual period begins. So, the increase in estrogen and progesterone level causes milk ducts in the breast to widen. As a result, the breast may swell and become tender. If the egg is not fertilized or if the fertilized egg does not implant, the corpus luteum degenerates after 14 days. Levels of the estrogen and progesterone decreases and a new menstrual cycle begins. So, if the embryo is implanted, the cells around the developing embryo begin to produce hormones called human chorionic gonadotropin. This hormone maintains the corpus luteum, which continues to produce progesterone until the growing fetus can produce its own hormones. Pregnancy tests are based on detecting an increase in human chorionic gonadotropin levels. So, there are a bit big words here which I'm saying. I hope you will understand them. Then ovulatory phase. The ovulatory phase begins when the level of luteinizing hormone surges. Luteinizing hormone stimulates the dominant follicle to bulge from the surface of the ovary and finally rupture, releasing the egg. The level of follicle stimulating hormone increases to a lesser degree. The ovulatory phase usually lasts 16 to 32 hours. It ends when the egg is released, about 10 to 12 hours after the surge in the level of luteinizing hormone. The egg can be fertilized for only up to about 12 hours after it's released. The surge is luteinizing can be detected by measuring the level of this hormone in urine. This measurement can be used to determine approximately when ovulation will occur. Sperm life 3 to 5 days, so an egg can be fertilized even if a sperm enters the reproductive tract before the egg is released. In each cycle, there are about 6 days that pregnancy can occur. Thank you so much for listening to my presentation about menstruation. If you have any question, please ask from the comment section. You will be answered. And people should be free to talk about their menstrual cycle. It's not a taboo. You should be free to talk about how you feel, your menstruation cycle. If you have a problem with your menstruation, you can visit your doctor. It's really funny, you find most of people going through something because they think that going to open up to someone because they are undergoing menstruation is like a taboo. It's like they feel like it's a shame or something. No, this is what is happening to us as human beings. And as a woman, you being a woman, you should be very proud about you having that menstruation period. Or maybe if you don't have and you are married, you will be happy that you are pregnant, you are waiting for your precious baby. So people should be aware of their menstruation period to control their sexual periods also. If you are a lady and you're not married, I will urge you to actually abstain from sex till you get married, because if you're not so sure about your menstrual cycle and you indulge yourself into sexual activity, the probability of you getting pregnant is fast. And you don't want to be a single mom, don't you? See you next time.